Good morning. I'm Latanya Smith, the Family Caregiver Support Specialist for Piedmont Tri-Regional Council, Area Agency on Aging, Region G. I am coming before you this morning to go over our request for proposal for state fiscal year 2026-2027. In this video, I will go over page by page the proposal, pointing out important information that needs to be noticed, making comments about those areas, and any additional information that you may need to know when completing this proposal. So first, we're going to start with our checklist, which is the very first page of the proposal. And in the checklist, you will fill in all areas, provider name and county, the amount that you are requesting, and your cover letter. The cover letter is in red because a cover letter must be included to state the request for Family Caregiver Support Program funds and how the applicant intends to raise awareness about the Family Caregiver Support Program. There must be a cover letter on your letterhead included in the proposal. If the cover letter is not a part of the proposal, I will contact you and ask you to provide that information, and the proposal will not be considered without it. And I will make the same statement throughout the RFP because there are certain things that have to be done before the proposal can be considered. So just a couple other things here on your checklist that if they're applicable to you need to be included. So you have your request for proposal signature page, a budget page, your FCSP narrative plan for service categories, and that will show a little more in detail in appendices A and B. Your priority group methodology, also instructions for that, specific instructions for that will be in Appendix A, your FCSP budget form, and a copy of your contract or purchase of service agreement if applicable. So certainly if you are using a contracted service or purchase of service agreement, copies have to come along with the proposal as well. Mailing instructions are here listed. All community service organizations will complete and initial all documents, including this checklist. Do not include the appendices, which are Appendix A and B, when mailing the RFP package. Mail the package to PTRC AAA, attention Latanya Smith, 1398 Carrollton Crossing Drive, Kernersville, North Carolina, 27284. I will say that given the dates you will see on the page as it goes live, you will have dates posted there where the packages have to be in office by end of business day, close of business day. However, it is okay to send the RFP to me via email, which is what most of our providers do. They do send a copy of the actual proposal, the entire proposal to me via email. That's the best way to get that in early, and so that I can go ahead and be looking at it, so I can go ahead and see if you're missing anything, if there's anything I'm going to request, any corrections, modifications to the proposal. It's best if you go ahead and get that into me via email, and then get it in pretty early, because if there needs to be any changes, you don't want to send those changes in the mail until those have been corrected. So the earlier you get it in, the earlier I can look at it, tell you if there's any modifications, and then I can tell you to go ahead and send it in the mail. Some people drop it off in person, some people, drop it in the mail. But as long as we receive it by close of business day on the date that's going to be stated with your information on the website, so we have to have it in that day by close of business day that day. So a lot of people do drive it over or hand deliver it. This is your signature page, which needs to be completed. Just enter in the information, state fiscal year, your organization name, address, phone number, if the executive director, email, program lead, and the program lead's email address as well. grant responsibilities of the funded agency. The agency administers FCSP services using FCSP funds allocated by the Piedmont Triad Regional Council Area Agency on Aging. Quarterly, the agency collaborates with the Piedmont Triad Regional Council and attends the regional FCSP partner schedule meetings, including conference calls and in-person meetings. The agency reports all partnerships, activities, and recommendations to the county planning committee. So I do know there are some planning committees that don't go into a lot of detail about FCSP, but certainly if you are attending the planning committees in your area, you would be good for you to give a report on the FCSP program, just because that information does show up on the unit of service report in those county committee meetings. So certainly if you are planning those attending those committee meetings, it will be good for you to give an update on the program there as well. Programmatic and budget change requests are submitted in writing for review and approval with the PTRC AAA using the FCSP budget revision form, which shall be dated and signed. That form will be posted on the partner portal on our Area Agency on Aging website, on the PTRC website under Area Agency on Aging. The agency maintains the required consumer contributions forms and documentations as specified in the Division of Aging and Adult Services Manual, Consumer Contributions Policy and Procedures, February 2013. This information as well will be listed on the partner portal with the other FCSP documents that will have to be completed to complete the proposal process. The agency FCSP coordinator attends any existing county FCSP subcommittee meetings. And then also, lastly here, this is something new we have not done in the past, but we are starting to do starting this state fiscal year. Please be advised that prior to receiving any reimbursement for state fiscal year 2027, attendance at an in-person family caregiver support program information session at the Piedmont Triad Regional Council is required. This session is intended to provide important program guidelines, requirements, and expectations necessary for participation. There will be several half-day sessions in person that we will do in, hopefully, the goal is in the month of August. So just be on the lookout for that. There will be several half-day in-person sessions. Each agency that will be a funded provider, any of our agencies that are receiving funding will be mandated to attend one of these task day sessions. So that's going to be a requirement that we will be doing, something where, like I said, that's new this year, that we will continue to do going forward. Again, be on the lookout for that information. You'll be receiving information on those dates in the near future. Someone from your agency, whether it be the FCSP provider, executive director, someone that's working directly with the program, will be expected to attend one of those sessions. And I will make note that right here, you see where we have this FCSP RFP May 2026. So this is the first area that you're going to see it posted or documented on the FCSP proposal, page 2. If you are using a version of another RFP that does not say May 2026, it will not be even looked at. So it's important that you make sure that when you're doing your RFP, you're looking for this right here, FCSP RFP May 2026. If it says anything other than May 2026, when I open your package and see that it's an older date, a different date, I'm going to inform you that we are not going to consider this application because you're using the wrong form. So just know that this is the most updated version of the RFP, it's important that you use this version because there have been changes. There's things that we have updated for with this particular version. So if you use any other version, you're not using the right version. Okay. Specifications of funding. Monthly, the agency will complete all data entry in the ARMS system, keep accurate financial and programmatic records, and will accommodate other requests by the Piedmont Tri-Regional Council Area Agency on Aging. Programmatic state-mandated spending limits per client will not be exceeded. Example, the $2,500 respite cap, as well as not exceeding more than 20% of the budget in supplemental services, which is your Category 5. The North Carolina Family Caregiver Support Program logo will be placed on all literature and materials funded by the FCSP in part or in whole. And if you're getting ready to do some type of program or put an order in for some swag, certainly you can reach out to me and I can give you a copy of a logo that you can use. Please review the RFP instructions again in Appendices A and B. Contact myself, Latanya Smith at Piedmont Tri-Regional Council Area Agency on Aging. And there also is my email, lsmith@ptrc.org for if you have any questions. Service codes, this is very important. Service codes not indicated in the original request for proposal will not be allowed to be added after the original code/budgets have been approved and awarded and entered into ARMS after July 1st of the current state fiscal year. So if you've completed your request for proposal, and then sometime in September, you decided that you wanted to add a certain category, something that you didn't put in originally. If you decided, hey, I want to start a support group and I want to use some funding from my FCSP program. If that support group or that series that you want to pick up under category service code 835 is not already in the proposal when you submitted it to me back in, or whenever they're submitted, which will probably be sometime in May or June. If that service code is not already there, we will not be allowing service codes to be added, because once you do your proposal, all of that information is put into ARMS. Once you've been granted funding, that information is put into ARMS specifically for that service code, for those service codes, and we are not able to, or we are not going to go back and add. And it takes a lot for our agent specialists to go in there and make all those changes. So after July 1st, which is when funding is awarded, when you will, that's official, not funding awarded, but necessarily, but that's the first day, official day of the state fiscal year, we will not be changing service codes. Will not be adding service codes or taking out service codes if those service codes were not already in a proposal, or if you had, certainly you can do a revision if you have to or have that need to move money around, but adding new service codes will not be allowed. Family Caregiver Support Program providers shall maintain a waiting list for all respite providers. Here is your signature page. Authorized signature and title has to be signed and dated. And then we go to page 4 where we get into our service category narratives. So category 1, plan for information and outreach. These are service codes 811, 12, and 14. If you are doing a service code and it asks for a narrative, the expectation is that there's a narrative. So the box is not there just because the box is there. The box is there because there is a request for a narrative. So in narrative form, explain the strategy your agency intends to use to provide informational and educational programming in your county. What is the plan to conduct outreach? Example, your marketing. That's real kind of simple. What is your plan to conduct outreach? That's the narrative that needs to go into the box. So please put something in the box if you are being funded for service code 811, 12, or 14. Category 2, plan for access, which are your service codes 821, 22, 23, and 24. As a best practice, a contact log shall be maintained by all FCSP partners, regardless of whether it is or whether or not the service code 822 is funded. So even if you're not funding 822, we do expect a service log to be maintained. And I will say only service codes that are on this RFP are service codes that are allowed for this state fiscal year. So you might go in your manual and you see other service codes that are not listed in this RFP. Those service codes, they are of the Family Caregiver Support Program. However, in this region, we are only using service codes that are listed in the this proposal. Okay. In red, it says here to indicate the number of the calls and clients that your agency anticipates to serve doing FCSP 2027. And there again, if you are doing whichever category code that you're using, whether it be 822, 23, or 24, we would like for you to indicate an anticipated number of calls or clients. If you're not using the categories that are listed, then this area shall remain blank. Category 3, action plan for caregiving counseling / support groups and training. And these are your service codes 831, 832, 833, and 835. Agency must provide a combination of support groups, evidence-based programs like your Powerful Tools for Caregiving, and or educational classes such as the use of TruAlta Caregiver Education Learning Platform. Provide your agency's plan to deliver a combination of these services in narrative form. Be sure to include the anticipated number of classes for each of the evidence-based programs, education programs, and the type of frequency of support groups. In Service Codes 835, caregiver training program is used. One offering must include disease-specific education sessions, evidence-based programs, powerful tools for caregiving, better building better caregivers, etc. Note that Service Code 835 is for the series-based training sessions. Here again is a box. The box means there needs to be a narrative explaining Category 3 in terms of what you plan to do. Okay, Category 4, plan for respite. These are your service codes 841, 842, 843, 846, 847, and 848. Category codes that will not be offered to caregivers should be left blank. Ensure all contracted agencies that will be providing respite services are listed in the agencies column. So there again, if you're using a contracted agency, that should be placed there so I don't have to try to track you down to figure out if that's something, if I see it somewhere, because most of the time they'll send copies of it, which is fine, which we need, but I also need to see it in the request for proposal in terms of the names of those agencies. Agencies providing respite must coordinate with Project Care and serve as a liaison for lifespan respite. In order to be eligible for respite care service through FCSP, the care recipient must meet the definition of frail as specified by the Older Americans Act. And I want to go back and touch on the Project Care and the lifespan respite. Anybody receiving funding that all of our agencies that are receiving funding for this particular program, whether they are providing respite or not, even if they're just providing information and assistance, they still are we are asking them to be the coordinator for these two respite programs. Because if you're a county that doesn't do respite, then there's still these respite options, which are your Project Care and Lifespan Respite. And if you're providing information, we are asking that you provide this information to your clients so they can have some type of respite program in their area. So anyone receiving FCSP funding must provide Project Care information to their clients when, as necessary, as well as lifespan respite. But most importantly, with the Project Care, especially if you are providing respite, there's that $2,500 cap, and Project Care offers vouchers in the amount of $500. Well, that goes in coordination with the FCSP $2,500 cap. So if you need to be in contact with your representative in your area with Project Care to make sure they haven't given out a $500 voucher and then you've given out $2,500 worth of respite care services. So that's, that has put you over the cap and you will be asked to, pay that back. So that's why it's important to be in contact with the Project Care representative because that cap works in coordination with the FCSP program with those vouchers that they are giving out. And we're asking that to be your responsibility as well as being the liaison for lifespan respite. Clients cannot self-referral with lifespan respite. They have to have someone to make that referral on their behalf. And our FCSP funded partners are the agencies that will make those referrals in your respective county. So you would have to initiate the application on behalf of your client for lifespan respite. I'm not going to go into a lot of detail about lifespan respite and Project Care because we do have representatives for both of those agencies that are will be able to give you additional information, answer questions. They also attend the quarterly meetings that we are suggesting or asking that you all attend. Those quarterly meetings provide lots of information. Project Care Lifespan Respite come on to the meeting, provide information about funding available in the counties across our region. So it's very important that you attend those meetings as well as you're able to receive information about updates and any updates with the state and that sort of thing with the Family Caregiver Support Program. So whenever we send out those, invites for those meetings, it's important if you're a funded Family Caregiver Support Program provider that you attend those meetings. So there again, there we are with Project Care Lifespan Respite. You are responsible if you're a funded agency. So that would be anyone that is receiving any kind of funding, regardless of what categories you're serving. You are the coordinator. You're going to be that person that's going to coordinate with Project Care and Lifespan Respite for the clients in your county. These are the categories for respite: 841, 842, 843, 846, 847, and 848. And as you see, these are all hourly programs. Okay. Please document any respite policies that your agency may have, including internal respite caps or one-time respite limits for caregivers, as well as project care coordination. It is recommended that all vouchers have an expiration date of 60 days or less. And that's because, you don't want to getting, in a situation to where you're towards the end of the year or the state fiscal year and you still have clients that are slow to move on using those vouchers and kind of holding up your process of trying to figure out where you're going to be with spending for the end of the year. So if you kind of put an expiration date on it, certainly it's recommended 60 days or less. It's not mandatory that you tell them that it's 60 days or less. That's just our recommendation, so you don't get caught up towards the end of the state fiscal year trying to figure out funding and what's going to be left if you're going to have to release funding because you have two or three people that are still holding on to vouchers that they haven't spent. You don't know if you can get those vouchers that those monies spent out before you need to. So just kind of to make sure that puts you in an odd position with trying to get spending down at the end of the year. We do recommend that you do give your vouchers a expiration date. Category 5, plan for supplemental services. Those are your service categories: 851, 853, 854, 855, 856, 857, 859, 860, 861, and 863. For this category, the care recipient must meet the definition of frail as specified by the Older Americans Act, and certainly that's all through your FCSP manual. No more than 20% of the budget can be for supplemental services. Um, So any categories that will not be offered should be left blank. There again, overall budget cannot exceed 20% for category 5 services. How will your agency ensure that FCSP clients receive temporary funding assistance and that funds will not duplicate or supplant other existing services? Please answer in the box below. So there's your narrative box, and please give an explanation in answering this question. Priority population and targeting outreach. Reference the FCSP manual, effective date July 1st, 2020, Section 5, Service Provision B, priority populations and targeting outreach. Please explain how you intend to raise awareness about the Family Caregiver Support Program. Describe how the needs of the most economically and socially needy, with the attention to low-income minority individuals, according to the Older Americans Act Amendment of 2020, will be prioritized in the delivery of these services. If you will look at the highlighted area, it says, please feel free to use the above exact language to be sure you are capturing this information in your methodology. So sometimes I have to go back and make note to agencies that they have not included all of these service needs here, which the methodology clearly states include and address meeting the service needs of each of the following service priority groups. All of these groups have to be in your methodology. If you do not have all of these groups specifically in your methodology, I'm going to come back to you and ask that you go back and put all of these groups in your methodology, which is why I say feel free to copy and paste this part of the methodology. At-risk older adults, including those that are frail and at risk of residential placement, low income, socially isolated, or historically underrepresented populations, Native American elders, older adults with limited English proficiency, individuals living in rural communities, lesbian, gay, bisexual, or transgender LGBT older adults. This has to be in your methodology. You have to include these priority groups in your methodology. You can write it how you want, you can, reword it, but these groups have to be included in the methodology for me to approve it. So there again, feel free to use the above exact language to be sure that you're capturing this information in your methodology. And staffing. What specific staff of your agency are going to be involved in administering the Family Caregiver Support Program? How will you ensure adequate staffing levels and program oversight? Please answer both questions in box below. This is a new question for this state fiscal year proposal, FCSP proposal, but we do want both of these questions answered in the box below. There again, if you're using a version, anything other than this FCSP May 2026 version, you are using the wrong version and you're not going to get all the new information that's been added to the RFP this year. Here are your appendices. There again, kind of looking at some of the things we already talked about in further detail, one being the priority populations and targeting outreach. Pretty much the same thing that was in your RFP that I asked you to be sure it included. It explains the Family Caregiver Support and Older Americans Act Title 3E, further explains the program and, giving priority to these population groups. These are your appendices. There again, do not submit this page. It also gives you information about eligibility for the program, which will always also be found in your FCSP manual. The budget requirements, which is one that 20%, no more than 20% of an applicant's budget can be allocated to category 5, which are your supplemental services. We talked about that. And it also indicates here four FCSP categories that we try to cover in some way across all of our counties, across the region, which would be our category one, information, category two, assistance and access, category three, caregiving counseling slash support groups training, and category five, which would be your respite. So we try to get those, at least those four categories covered in some way. Here we talk about a respite cap, which is that $2,500 per client. And then your coordination with the project care to be sure that you do not exceed the $2,500 cap. There again, project care gives out $500 vouchers. You want to make sure that you're not, so they hadn't given out a voucher and you didn't know it, and then you've already exceeded your $2,500, because then that puts you kind of in the bind with being over that cap, and puts you on the hook for paying that back. And then in terms of the budget form, please include staff name, position, any budget expenses, which is your FICA, insurance, retirement, using staff lines, and note that part-time or full-time on the budget form. So you'll see that on the budget form when you start to fill that information out. It is very important that unit rates are on the RFP. So on the in the RFP on the budget, not the RFP, but on the budget. Unit rates are needed for unit-based services. Please indicate number of clients estimated to be served. Also note, without a unit rate or client numbers, the FCSP budget cannot be processed. So if you're doing respite and your unit rate is $25 an hour, it has to be on the budget form. That's the first thing I'm looking for when I look at your budget. If it's not on there, I cannot process your application. If there's a number that needs to put in terms of the number of clients that you're expected to serve or that you're estimating to serve, if that number's not in there, I can't process the application. The budget has to be complete. It has to be complete. All the information has to be there. And the longer it takes me to try to reach out and going back and forth with getting that information, the longer it takes for me to approve your application. So try to remember on that budget that you have your unit rate and you have your estimated clients, that number to be served is already on that budget. If outside service agencies are used and listed under Category 4, Plan for Respite on the RFP, either a subcontract or a purchase of service, please include their names and descriptions on the budget form. If using either a subcontractor or a purchase of service agency, please send a copy of the contract or purchase of service agreement with the submitted RFP, along with a copy of the agency's current in-home aid license. So these appendices kind of just are very important because they go back and remind you of things that you need to do, making sure that certain things are in that RFP. So even though the appendices don't have to be signed or whatever or returned, I don't want you to return those. Those are for your information. But even though, they're at the end of they're here at the end of the RFP, they're important because they give that additional reminder of what you need to go back and look for to make sure you've done in the RFP. And then this last page is the actual service and service code. So these are the only service codes that our region is doing this year. If you have a service code on that RFP that is not here, then it is not a service code that Region G is using this year. Okay? So there you have it. That is your formal Zoom information session with the RFP. I tried to go over the things that have changed this year with the RFP. There again, if you're using a version that's not this version, then you don't have the most updated information. Some of those service codes are different. They're going to look different on the budget than they did last year. So whenever the information for the program goes live, the most recent budget documents, RFP, any of the attestation forms, all of that information is going to be updated to this year. So if you're using anything other than what is going to be live once it goes out, you're using the wrong information and it will not be considered. So I am working very hard on getting information up on the website under the partner portal. We are hoping to get that information out soon. I will post that information to everyone. It will be on the website. Or within the next week or so. So be looking out for that. But also we'll send out a formal notification to any of our current funded partners that are already looking to be partners again next year. You will receive notification from me as well that that information will be going out on the website really soon. There is an attestation form that will be on that website. The attestation form merely states that you have seen, listened to, and watched this video, and that you've done that. So that's part of the asking for this proposal. So the attestation form will be completed and returned to me so that I know that you've seen the video and we know that you're up to date on any of the new information that is out. Thank you so much for listening and hope you have a really great rest of your day.